Okay. All right. Good afternoon, committee members and other parties of interest. The oral presentations and evaluation committee for request for proposals RFP-24-24912 self-funded group health plan for the Human Resources Department is being held by means of communication media technology. Active participation will be for the committee members only. This meeting is being recorded and provisions have been made for any member of the public desiring to have access to view the recording after the meeting is ended. Please be advised that there is a cone of silence still in effect, so all meetings, communications, correspondence must be directed at my attention. As a matter of housekeeping, the technical advisors and project observers that are in attendance via communication media technology, please mute your audio unless speaking and/or turn your cameras off, please. And if you've called in, do not put your call on hold. I'm going to now hand this off to Scott Stromer, our Director of Procurement, for some important instructions.
So as you know, this is going to be an exempt meeting under Florida law. So this is going to be recorded and will be shared publicly after this. So the reason why that's important is you, as well as the other two, had a pretty broad trade secret claim. And rather than litigate that and go through that, I'll just deal with it a different way. So when you're giving your presentation, be mindful of that whatever you share in this forum will eventually make it to the public. So rather than get into the actual details, you probably couch those as, a little bit, kind of ghost those a little bit perhaps. The committee also is reminded that when they ask questions, they try to couch those questions in such a way so it doesn't disclose things that may or may not be included in that trade secret. If your documentation that you handed out, we'll have a copy of this for the file. Appreciate you not doing a presentation. We would have stopped you. If there are any trade secrets in here, let me know, and then we'll make sure that this is also part of that record. So other than that, or if you have a question about it, don't hesitate to ask us, during the middle. But the whole purpose is to make sure that you guys stay whole and everybody else stays whole. I'm not the felon. Okay.
Good goal. All right, so we're going to go ahead and let the committee members introduce themselves first for the record, and we're going to go ahead and start right here with Cheryl.
Hi, I'm Cheryl Murphy. I am the Wellness Manager for Hillsborough County.
Mike Drago, Senior HR Partner for Total Rewards.
Donna Stark, Senior Functional Business Analyst with Enterprise Solutions and Quality Assurance.
Tim Pearson, Union President for the firefighters.
Colette Duffield, Project Manager with the Healthcare Services Department.
Tom Bessler, I'm the county's Chief Financial Administrator.
Irma Muka, Budget Managing Director with the Management and Budget Department.
That's another mouthful too.
Jamie Logue, I am the Senior Client Manager at the Baldwin Group.
Jean Kelly, Client Executive Leader at the Baldwin Group.
Nicole Betsy, Baldwin Group.
I'm Rebecca Burley. I'm the Benefits and Retirement Manager in Hillsborough County. Good to see you.
Paul Almeida, the Contracts Manager for HR.
Attorney Mayor, Senior Assistant County Attorney for Labor and Employment.
And we will also have with us Christy Alessino, Procurement Operations Coordinator. Okay, so our presenters are going to have a total of 45 minutes, 30 minutes for presentation, and then 15 minutes for the questions and answers period. We're going to begin the chance to introduce yourselves and everything for those 30 minutes. We'll give you a reminder around 2 minutes so that you're aware, as well as the question portion will also give you a reminder. And yes, thank you. Somebody popped up. We need to let them introduce themselves online as well. I apologize. So let's go ahead with our other advisors and observers online, please.
Hello.
I love that. She's over there.
Hi, Ivy Martin, Human Resources Director.
Okay.
Hi,
Fancy.
I'm Maria Liddy, HR Division Director.
Hi, I'm Bindi Shukla, HR Fiscal Manager.
Neil Gemma, Executive Board Member, Local 2294 for Hillsborough County Firefighters.
Thank you, guys. Sorry about that. So we will go ahead and hand it off to the Cigna team and let you start your introductions and then go from there. Thank you.
Sure. Hi, my name is Bart Gerber. I'm in Cigna Pharmacy Benefit Management.
I'm Beth Smith,
Vice President of Government and Education.
Linda Bosch, I'm a licensed clinical social worker and director of behavioral health services.
Ben Hugel, National Account Executive, Cigna.
Hi, Christine Castelvi, Market President for Cigna Healthcare.
Dennis May, Assistant Vice President of Provider Network Management.
Hey, Angela Reddy. I'm the Senior Medical Director at Cigna and the Market Medical Executive.
Hi, everyone. I'm Peter Burrell. I'm a Director of Digital Engagement and Strategy with Cigna. Thank you for having us today.
Okay, I got my timer too, just so you know. The timekeeper over here. Right.
All right, you ready to roll? All right. Well, thank you again. Like I said, Christine Castelvi is Market President. I also serve as the executive sponsor for Hillsborough County on behalf of Cigna. I've been with the organization for 23 years. First and foremost, I want to thank you for your time today. Thank you for your business. You've been a client of ours since 2014. So we're excited to present today. Look forward to potentially continuing that relationship, but also really focused on looking forward toward the future. On a personal note, I live right here in Hillsborough County, along with my family, my parents, our extended family. So this is a very personal client for me and our team, and it means that much more to be sitting here with all of you today. What I want to say first and foremost is our alignment and partnership within the community. That's one of the most important and favorite pieces of my role as Market President. And there's been tons of opportunities with your leadership, your HR team over the years, community events, and to be aligned alongside of some of those organizations. One specific event comes to mind, an event that we hosted in May of this year, where we had the opportunity to bring in your employees and their family members over at the Tampa Bay Buccaneers training facility. I know many of you were there. And I think about that opportunity to really engage on more of a community standpoint and share and expand all of the health services that we bring. That's just one example that comes to mind from what we've done in the community. There's also a lot of alignment within your organization and ours on social determinants of health. So those areas of opportunity to bring food, either healthy food, those individuals that don't have access to food and have food insecurity, financial well-being, certainly health services. So a lot of that community alignment during around social determinants of health, I feel is that one of those other really important kind of executive sponsor and partnership alignments that we see through both of our organizations. And I'm excited that what you'll hear today through our proposal will expand on a lot of those opportunities as well. And then getting into just truly the benefit portion and the clinical needs of where we align. And this is one of those exciting areas that, you know, being a long-term individual within Cigna, but also being a long-term executive sponsor for Hillsborough County and sitting through our monthly stewardship meetings, our meetings with individuals like Dr. Reddy to go through your utilization reports and grow and build strategy around not only a lot of those clinical programs, but health engagement programs, access in a variety of ways to your employee benefits. A lot of that is all clinically based. So what does that mean? Hillsborough County is one of those organizations that when we say partnership, you know, a lot of people throw that word around. But partnership for us is something that certainly comes to mind when we think about Hillsborough County, because when over the last 10 years, when we've had opportunities to create pilots, for instance, Cheryl, and the advocate of that, just some of those areas around the clinical side where we said we want to try something new, like a pilot program. Hillsborough has been one of those first organizations to raise their hand and say, let's get ahead of it. Some of that is preventive in nature, like I said, some of that's access, like telehealth. But some of it is also around specific diagnostic areas, like diabetes or oncology or MSK. And you'll hear about that through our team that we brought in the different areas of clinical innovation that we continue to drive in the marketplace. Before I turn it over to Ben to kind of get into some of our financials, I think the other really important piece as we sit here after a long 10-year relationship and you all make a very important decision around the next 5-year contract is we really appreciate a procurement process. Not because it's easy, not because it's not time consuming. All of that is, and we appreciate your time sitting here today, but it's really important. It's important to stop, check our services, and most importantly, we as a team have really made a big, strong financial investment toward the proposal that we're offering, along with a lot of innovative services that we continue to drive, that we've invested in the contract that we'll go through today. And we've built all that around your needs, your RFP, the questions within that, and we're excited to continue the conversation today. So with that, I'll turn it over to Ben.
Thanks, Christine. Good afternoon, everybody. I appreciate the opportunity this afternoon. I'm going to walk you through on slide number 4 some of the proposal highlights. A lot of it, Christine kind of shared, was around partnerships. And I want to kind of echo her thank you. It's been my privilege to support your team, your employees, and their families over the past 10 years. So it really hits home to me. I'm a local resident as well, and born and raised right here, in Tampa. So some of the items that I wanted to share were around fees. The very first item on the list on slide 4. Our fees were positioned 3% lower than they are currently. Our fees have been in place since 2014. So you'll see an overall reduction in our fees, and those are held flat for 5 years. You also find a reduced FSA fee and a repositioning of the HSA fee where it was kind of melded before. It's now kind of broken out today, but in total, 3% lower than where we are with multi-year rate holds. From a fund standpoint, we decided to position the use of the fund differently this year. Historically, back in 2014, we positioned the MWDWB strategy. We positioned the on-site resources. We positioned a lot of the programs and services. What we wanted to do this time was offer the financial resources and allow Hillsborough County to choose what is most important to you. And so we have included a number of opportunities that we'll highlight today, but we wanted to kind of reverse the positioning and be sure that Hillsborough County had the say in how you want to position those resources. We thought that was very important. We are including a no-cost client-specific toll-free line that I'll talk more about on a slide here in just a moment. Pharmacy BART is going to get into Clear Choice RX, and basically it's a transparent financial pass-through model. You pay what we pay. So that is very different. It's very new in the marketplace for us. I think you'll be really excited about that. From a performance guarantee standpoint, we've positioned over 70% of our ASO fees at risk around performance guarantees. And we're positioning either your choice of a discount or a trend guarantee with substantial dollars at risk. Virgin Pulse and Personify, we would include the highest package that's offered. We call it the custom package or connected package. And then we will have an option available for total population solution beginning in January of 26. Again, the on-site resources, Hillsborough County chooses. If you would like to retain the 4 on-sites that you have today, that's great. If you want to add to that team, we've got the fund and the financial resources, but ultimately it's Hillsborough's decision on how to position those resources. From a network discount standpoint, we've repriced at 68.2%. So a really good result from a unit cost perspective. And Dennis is going to talk a bit about our network. And then just a couple of extras down there at the bottom. But those are some of the highlights. And we're really excited about this opportunity. On the next slide on 5, I won't spend a whole lot of time there, but you will recognize if you participated in any of our annual plan reviews, our strategy meetings, any of our clinical conversations, any of our Well for Life opportunities, the team that you see here. Everybody contributes, everybody brings offerings, strategies, opportunities to the table, and we'll show you later in the presentation how Hillsborough County has engaged in a really go deep and meaningful way to deflect in terms of cost, to better manage, to look toward improved health. And then lastly, for my slide on number 6 is around the personalized telephone number for Hillsborough County. I have this on a few of my accounts, and it's one number that can be used both for your Cigna resources, but also for your non-Cigna vendors. And so you can offer one phone number if you want to send folks to Humana Vision, for example. We will send that call to Humana for you. If you want to send a call over to the Employee Medical Center, we can do that. So it gives you a one-stop phone number for all of your Hillsborough, all of your Cigna and non-Cigna vendors that you work with. We can do up to 8 different kind of call forwards. We also have sub-menus that can kind of maximize beyond the 8. So it's a really creative solution. We thought that you would appreciate that. Now I'll hand it over to Beth to talk a bit about government and education.
Thank you. So I won't spend a lot of time on these. It's, Cigna has a specialized focus on public sector clients. And in that, we've created various programs and wraparound services that are specialized for our public sector group. Specifically, if you turn to slide 8, our Smart Support program. So our Smart Support program layers over your One Guide solution, which is our concierge customer service line that's available 24/7, 365, live human being that you have access to. But what that Smart Support program really does is it bases all of the services that are provided to Hillsborough County onshore. So no additional cost, and that is a main focus of Cigna, to make sure that we're providing services for our public sector groups, because you are a unique population versus just a regular commercial client. One of the cool new kind of innovative solutions, if you turn to slide 9, that we've implemented at several of our public sector clients across the state is a mobile van. So this van would be branded Cigna, but we could also co-brand it with Hillsborough County, and it would have the ability to drive around the county and hit various facilities that may not have access to that employee medical center as easily. So health coaching can be done inside this. Biometric screenings, vaccinations, various things like that. We've implemented it at Orange County Public Schools. The government of U.S. Virgin Islands has a couple of vans, and it's just a way for us to bring healthcare to your employees in an innovative way. Now I'll hand it over to Dennis.
Oh, thank you, Beth, and thank you, committee. As the name would imply, network management. So what our team does is contract the network providers and maintain those relationships with the network providers. So I'm going to depart a little bit from the slide here, because there's been so much activity in that contracting space, particularly within the Tampa area, that I thought I'd give what I'll call a state of the network address, because I think there's been so much activity, so much recontracting and renewals, that sometimes that can lead to a volatile network. We had over 80% of our hospital system negotiations up for renewal in the past 12 to 15 months. You mix that with a whole bunch of large providers in the area, physician providers in the area up for renewal, as well as all the ancillaries, the ASCs and the urgent cares. It made for a very, very active time for us, unprecedented, with a number of renewals in there. So I just wanted to make everyone comfortable here that we're at the tail end of this, almost out of that mix. And we had no interruption to our network access in the commercial medical space. All have renewed with multi-year deals. And I think the most important piece of that is, we did this at a time of obviously some very significant inflationary pressures for everyone, but particularly with the healthcare providers and the hospital costs and the rest, as well as some provider consolidation, I'll call it. Whenever those providers acquire others, it's kind of a race to the higher rate. So it puts enormous pressure on us to temper those increases, because both the inflation and the consolidation lead to higher demands from our healthcare providers for justifiable reasons. So with all that said, not only did we have no disruption to the network, and we have a very stable network now due to the multi-year deals, our competitive intel also tells us that through that process, we've also improved what was already our best-in-class discount position relative to our competitors. So, really good results for the past 12, 15 months. Real proud of the work that our team has done, to support and serve up a network that has, great access, very high quality, and equally important, if not more importantly, an affordable solution to our clients. So, happy to take any questions on that during the Q&A if there's more detail that you'd like there. But at this point, I want to turn it over to Dustin Reddy.
Thank you, Dennis. Thank you. So as we talk about healthcare, right, we at Cigna, it's very important that your employee is having the best care. So we focus on outcomes. We focus on quality. We focus on affordability. How do we do this? So if you look at the slide 11, right, we partner with our community physicians, and these physicians are very high in performance and quality. And I meet with these physicians, we call them the collaborative accountable care partners within the community. So I meet with them on a quarterly basis, and we go through the outcomes specifically for our clients. And we let them know that the quality outcome, the performance, and how our Cigna members are taken care of is very important. So our CAC partnership, we don't own these doctors, but these are doctors that we know that we can partner with them because of how they take care of patients, looking at their rating, looking at their outcomes. So that CAC partnership is extremely critical in finding those physicians and making sure that Cigna and those physicians work together to make sure that those quality outcomes are met on a quarterly basis. If they're not met, we go through strategies and solutions for best practices so that your members are continuously getting the right care. Now, one key partnership that we do, or one key part of our offering, is our case management. So when someone is diagnosed with a complex medical condition, trying to navigate the healthcare system is a very complicated healthcare system. Our case managers, they are there as the care navigators. Once that diagnosis has been made, and this member now gets discharged into the community, our case managers will continue to make sure that that care is navigated, whether that patient needs to have oncology care, whether they need to have radiology, whether they need to have gap closures, social determinants of health. They may not have food at home. They may not have they may not have the resources to pay for utility bills. So our case management is extremely important to close those gaps to make sure those patients are able to navigate those care. So that's on slide 11. That's one thing I wanted to call out there. As we move over to slide 12, as we continue to partner with the different services and vendors, Cigna will continue to make sure that we are having the best outcomes for your population. And one thing I wanted to call out is that currently, we know oncology care is really up there. And I know that you have Oncology Consult, but I also wanted to talk to you about some other programs where cost of care is very high, and that's going to be musculoskeletal. So as we look at musculoskeletal, right, we have the pathway bone and joint. Say, for example, chronic back pain today in America will affect up to 80% of the population throughout their lifetime. Currently, the statistic says for women, it's more, it's about 40%, and for men, it's 39%, according to the CDC. So when someone has a back pain diagnosis, they're now trying to figure out what is the best treatment. So for the pathway bone and joint, we want to make sure that when they're in that program, it's a bundled program where those Pathwell doctors now know that conservative management is the first thing for that member, whether it's injection, physical therapy, and lastly would be surgery. Now, if that happens and this patient is better, great. The Pathwell bone and joint works. Now, if we look into the other one, which is the virtual second opinion, say, for example, that patient continues to have back pain. Now there's a virtual second opinion with the Cleveland Clinic. So that member is now not feeling well. Pain is intense. They've gone through surgery. Well, we have a solution to help them. What is the next breaking technology and the next best thing for that patient? So that second opinion is also very important. So we're continuing to innovate. We're continuing to integrate, and we're continuing to partner. So that's all I wanted to take away, and I'll pass it on to Melinda.
Thank you. So I am very passionate about all things behavioral health, but to be conscious of time, I'm happy to dig deeper on any of this during our Q&A. But I want to take your attention on slide 13, that members on the plan have access to that concierge level of care, providing that highest level of support and assistance along their journey, regardless of the level of acuity that they have. When we think about someone with a back pain concern, we know that they're also going to need support for behavioral health, whether that be with behavioral modifications or even to navigate for preventative approaches for depression and anxiety that are connected to that care. These are going to be available also through the unlimited support that's going to be for the consultations that are in the moment, as well as the connection to the clinical navigators and 100% follow-up on all of those connections, whether they're telephonic or digital. Now, what you're seeing on slide 3 is going to be for those that are on the medical plan. But on slide 14, this is your total employee population and all of the members of their household. When we think along the lines of EAP, it's your front door solution for behavioral health. We have the option to utilize some of the enhancements, and that includes the EAP solution for Confide mirrors that Cigna Total Behavioral Health solution with that concierge level of care, really providing a hand-holding approach to all of the members of the employee population and the members of their household. Everyone would get up to 6 visits at no cost per reason per year. Now, when we think along the lines of some of those additional innovative approaches, you can see on slide 15, what Ben had mentioned were some opportunities that Hillsborough County can really customize what they would like to see in place. So when you think about adding to those on-site options, you have an on-site behavioral coach. This is someone that would be integrated into that health center care team. So thinking Cindy and Adam, they would work together on coaching for behavioral health. We also have on-site EAP options. This would be someone who would be dedicated to you all as a way of connecting a few days a week, up to 20 hours a week, providing those EAP solutions. And then also we have the on-site behavioral therapist. This is a dedicated provider, behavioral health clinician, that is integrated with that healthcare center team and provides an unlimited number of sessions to the employees in a way that we can customize to meet your needs. And then also they become a care coordinator to connect them to all aspects of care, whether it's part of the plan or part of an external, maybe they're not on our plan. Now, I went really high level just because I want to be aware of our time. Again, I'm happy to dig deeper in Q&A, but I'm going to hand it over to Bart.
Again, Bart Gerber, Pharmacy Benefit Manager. I met many of you before. Some of you have probably also met a member of my team, Mina. Unfortunately, couldn't be here today. The poor guy's on a cruise. And wow. So I'll run through some of the highlights on the pharmacy benefit renewal offer. Like Ben had mentioned in the beginning, one of the things that's different from the offer this time versus the past is we are offering what's called a transparent pricing arrangement, which means you pay what we pay for medications. We're not making a spread out the medication. We get compensated for our operating expenses, et cetera, through an admin fee, a simple admin fee, no more spread pricing. The admin fee is a low $3.95 per prescription. We also are offering discount and rebate guarantees as well, just like we always have. And those improvements in our rebates will bring the county a savings of $2.5 million in year 1. But we're also passing through 100% of rebates that we obtain from pharmaceutical manufacturers. And in year 1, you'll be receiving, we estimate, $1.7 million more in rebates than you had in the prior year. And when you look at the 3-year total of rebates that we'll obtain from pharma and pass to you, over $35 million of rebates. The pie chart that you see on the bottom left corner of slide 16 is just kind of showing you like the 4 different areas of pharmacy benefits. There's the retail piece of the pie, there's home delivery, there's specialty, there's rebates. It's all passed through. So that's a unique element to this deal that I just wanted to call that out. On the next page is the kind of the full set of pharmacy solutions that are in place for your plan. Now, the county's made some really, really excellent choices in the pharmacy programs that you put in place to help control costs while keeping the benefit rich, keeping it generous. There's 17 different ones on here, and I'm not going to go through all of them. I'll just highlight a couple of them. I'll talk about the one in the top left corner at first. That's your prior authorizations, your quantity limits, your step therapy. We call that clinical edits. Those help to ensure appropriate use of the medication to the appropriate member at the most cost-effective means. That has helped to save the county $5.7 million in 2023, and we're seeing similar savings in 2024 as well. I'll shift over to the specialty column because the specialty column is, especially drugs in general, are a big driver of overall healthcare costs and pharmacy costs. The Save On specialty program, that very first one listed in column 2, that is a program that obtains pharma copay assistance, so money from pharmaceutical manufacturers to give copay assistance to members who are taking high-cost specialty medications. It drops their copay down to a $0 copay, and it helps lower costs for the plan overall. The next two in that same column, I'll kind of bucket together: site of care management and pathway specialty. Because the county is using Cigna for both pharmacy and medical benefits in an integrated sense, we now have the ability to look at the pharmacy benefit or look at the medical benefit for each particular drug, each particular specialty drug, specialty patient, and see which site of care is most cost effective and most clinically effective for that patient and for the county. So through those programs, we're seeing almost $1 million worth of savings in 2023, and we expect to see the same or more in 2024 once we have those numbers. I'm going to jump over now to like the rightmost column, which is member service. Okay, yeah, so it's members focused digital tools. Those are the digital tools that are available on laptops and on our phones to give your members access to their benefit. Specifically for the pharmacy benefit, Peter's going to go into more detail broader than just pharmacy, but just for the pharmacy benefit, I'll focus on the fact that members on their phone, there's power of information. It's right on their phone through our app, and they can see which drugs are covered. Are they being processed through home delivery? Are they processed through retail? How much have they spent on it? Again, they can cost price. They can compare prices at retail pharmacies versus home delivery. They can see which drugs might require a prior authorization. All of that information on the palm of their hand. The idea here is to give them access to very important actionable information so they can make the most wise choices for themselves and their family. Pass it over to Peter to talk more about digital.
Sure, that's a great segue. Thanks very much again, you guys, for having us. I think what we've heard is a lot of different elements of very valuable benefits offerings for your folks. What we're trying to do on the digital side is offer a front door care to all of those benefits, right? When you enter your home, you have a lot of different choices to make, but it's all familiar to you. Same thing with My Cigna. We are hyper-personalizing this experience in order to make sure that the data we have on the individual, the information we have about their plans, all are brought together in what we call a business intelligence platform, all right? So when you think about that, it's just very important to recognize that My Cigna is an important tool for your employees and their family members to use. Certainly, one of the best things that I can come here with is to say that your percentage of registration is at 88%, and the baseline, the industry rate is actually 80%. So kudos to you all for bringing this forward for your employees, because when you get to that point, you wind up with an experience for your employees that complements the high touch. That's the 24/7, 365 contact availability with the high tech, which is a high level of quality service through that methodology, right? That's that premium mix that we want to bring to you and your employees. We also want to offer the fact that it is an integrated approach, right? So we talked about MSK. So let's say it's a first provider. That first provider injures their back. Well, in all likelihood, they could become depressed because of that injury. What we want to do within the My Cigna ecosystem, if you will, is present all of that information to them in one place, make it easy for them to find the right care at the right time through our app, through our browser, through our acquisition of MD Live, et cetera. So at the end of the day, we want that first provider to be able to access the care and be able to filter that care and take the guesswork out. So a first provider can search on behavioral providers who actually service that specific community. All right, so every day as we move forward, and I'm going to end with this one slide. You guys have been with us for 10 years in a very short period of time of late. We've already accomplished all of these different things, including that mention of MD Live acquisition. We're in flight on some really important additional ways to personalize it, including we've just introduced My Cigna in Spanish. And we're looking for other ways to continue being more predictive in helping your employees really start to take care of their own healthcare needs in a way that is more preventative than it is responsive. So I just want to give you that concept. I wanted you to think about the integration offering that we present with this digital channel. And I wanted to say once again, thank you very much.
Appreciate it, Peter. We'll wrap on slide number 22. And it's a real busy slide, but we just wanted to share all of the programs and services that have been added since 2014. And it comes with a great partnership between our organizations, generated over $150 million in savings. You can see on the right-hand side in terms of your annual trend, 3.4% we've averaged since 2014. The savings alone in 2023, $18.7 million, and many of the health improvement and engagement results come through the partnership with Wealth for Life.
I think maybe time for Q&A.
Yes, so we will go ahead and open it up for the evaluation committee to start with their questions. Who wants to go first?
I have a question. On the proposal summary, under extras, it lists Embark. Is that not one of the capitated costs in your proposal?
Sure. Yep. You go ahead.
Oh, I'm sorry.
Yeah, go ahead.
Embark is a protection benefit for gene therapy. So these are the, starts with about an $800,000 therapy all the way up to now about $4 million gene therapy. That protection benefit right now costs you 99 cents per member per month. Any excess is returned to all of the clients, which over half of the resources financially have been settled and returned to clients. So it's one program to socialize the cost for gene therapy. And there are another 15 gene therapies in the pipeline. I believe that we have 8 or 9 today. So eventually it will be a catastrophic cost to health plans, and everyone is choosing a way to kind of protect themselves with respect to gene therapy.
I like to think about it as we want to take those lightning strikes, which are very hard to predict on, say, a $4 million cost, which are life-saving, life-changing, and really take them completely out of the cost of the plan so they don't affect you. And from a capitation standpoint, again, we give back to the client base that participates on anything Cigna does not spend in that pool.
And the cost of care to the member is zero. So on the HSA, they have to meet their high deductible per the IRS. But aside from that, it's totally paid outside of the plan. You don't have a stop loss deductible to pay from a county standpoint, free care to the member as well.
And it was first to market with it.
You're not required to have the program. You've had it, I would say, probably for the last maybe 5 years or so.
Yeah. So you mentioned that the capitated costs were given back to the members. Can you expound on that just a little bit? If they're not used is that in a particular year?
Sure. It's
how is that?
It's separate member for client, right? Yeah.
Yeah, it's a client cost. And so the financial resources that remain at the end of the year are settled back to clients. Eventually the cost will go up beyond the 99 cents. I believe there's a 2025 increase that you will see. But the point is that it's a pool of money that is available to pay the gene therapy claims that come in, but the surpluses that remain in there are settled back to the clients. So for the last 2 years, more than half of the pool have been returned to the employers. So in other words, they paid in, the pool was at a surplus, and the surplus was returned back to employers.
Is that the only one of your capitated costs that is treated that way, is with the Embark, or all of them treated that same way?
Just Embark is treated that particular way.
Okay, thank you.
I'll piggyback on the capitated cost question. The behavioral health capitated cost, how does that compare to what we're currently contracted with you? How will we see that change our overall cost?
The behavioral health is trending at a faster rate than any aspect of healthcare, and probably has for the last more than the last decade. We see the utilization continue to increase, not just at a cost level, but also for at the member level. We're now seeing, like for Hillsborough County, depression is the #1 chronic condition within this population. We normally see comorbidities in many different areas of healthcare, diabetes, low back pain, many different other chronic conditions. We typically see the total cost of care for behavioral patient that has other comorbidities up to 6 times greater than someone who does not have a behavioral health condition. We would expect the capitation to continue to trend similar to your medical trend that you're experiencing. So the capitation rate does tend to increase. We did happen to go upside down during the pandemic. And in other words, we took on a couple of years of losses because we paid out more claims than we collected. So there is no risk to Hillsborough County associated with the capitation model. Cigna does carry that risk, but you will see, an annual adjustment to capitation like you would with any other type of healthcare cost.
Let me rephrase that question a little bit. Sorry.
No, I was going to have.
I figure out how to rephrase that question. It seems significant. And looking at it as it's being presented, it seems that it's going to be a significant increase to the ASO fees, in addition to the ASO fees. So how is that comparing to what we're currently paying? Does that make sense?
Yes, yes.
Okay.
So can I say it back to you? So I'm hearing you. So you're asking if the model that is in place today,
yes,
is it different than what's being proposed?
Pricing wise.
Pricing wise.
I see the model and this is different. Absolutely.
Yep.
Yes. But pricing wise, how is that?
You want to?
If I could just say, one thought is if we think about where the ASO fees are going down this year, and you think about the additional pharmacy pass-through approach, right? These are ways that in an overall financial picture, we're trying to make sure as cost in this particular diagnostic space and our approach to that holistic taking care, which we want to hear from, is we can help offset your total cost because we are reducing other fees, and we are helping to take some advances in the pharmacy cost into that whole picture of what you're paying in those fixed costs. So in addition to what Ben said from kind of a clinical standpoint and an approach standpoint, there's a wraparound, a lot of service standpoint that we want to hear from as well.
Yeah, so when you think about when a member is getting connected to care, so we think about that back pain, right? From there, they're going to get connected also to the behavioral health services. The capitated model is going to, the risk is going to be on Cigna. So members are going to go to an in-network provider. We're going to cover all of those costs. We're also going to make sure that we're connecting members to all of the care that they need within the network. And what we're seeing is that there is such a demand on behavioral health that we're struggling to find enough providers in the nation. So when we're connecting and contracting our providers, we're not only making sure that they're going to have availability, we're guaranteeing that availability, but then we're also making sure that they're going to be able to meet the needs of each of your members. And, when I think first responders, there's additional training that's going to be needed there. They're going to be up to date on that. We're making sure that there's going to be access in the different modalities, whether it be texting and messaging capabilities, video, and even those in-person visits. And then there's going to be that collaborative approach. So that way we're connecting them to medication management. When pharmacy is seeing that they've got a prescription, but they don't have behavioral care in place, we're getting them connected back to manage the condition so it's not worsening as well.
I don't think I'm getting the answer.
So
I think maybe you can ask it differently.
The behavioral service EMPM charge is going to be a new charge for us. Is that?
That's what we're trying to do.
It's currently there. You're currently.
Okay, so my question is, how is it currently?
Oh, what is the current PMPM versus
That's what I was trying to,
Okay.
I think money wise.
I don't know the difference.
So right now, I believe,
We did report that in the RFP response.
I don't remember what the number was.
And so we would have to find the response within the RFP, but we did provide the cost.
Yeah. And that's already accounted for in total claim costs annually. So that should already be accounted for in all of what you're currently your current model at Hillsborough.
I can speak to, in our portion, I will speak to where you can find that information. Perfect, thank you. Because it is
Thank you.
from public disclosure. So, thank you, thank you.
All right. And so that's why I mentioned, let's think about total cost too, because we recognize if there's a PMPM increase, we need to help the county offset it in other ways, which is why we've invested in other areas as well.
Correct.
Great. Sorry to keep answering.
No, that's okay. With the question of cue and answer, I want to get you the answer.
I have more questions, but I want to give other people a chance to ask because.
Go ahead. I had another question, but it was already answered in the presentation. So.
All right. All right, here we go. Okay. Chronic condition management programs. I noticed, basically, I just want to get a clarification. It seems like what you're saying is we're going to give you this lump of money and you can choose what you want those chronic condition management programs to be. Is that correct?
As far as the $2 million fund?
Yes.
So that encompasses all of the resources in terms of the MWBE fund is a part of $2 million. Your on-site employees, your employee medical center, any of your, you choose your EAP, the current standard or the buy up to confide. So all of that would be a part of the $2 million that would be covered under the fund. Does that answer your question, Cheryl?
Your condition management and your chronic conditions, those are already,
They're
those are
part of the-
already included into the ASO fee. So that has nothing, that 2 million won't. Yeah.
Staff, is staff included in coming out of that 2 million or is it included?
So that our on-sites, the health coach,
Your on-site.
one claims rep would still continue to be Cigna employees.
Correct.
The other two would continue to be paid through minority funds. Is that correct?
Right. The 2 million would also include the commitment to DWBE. So we would need to meet our minimum under that in order, to be compliant.
Very good. Okay, thank you for that. Clarification, did I hear you say that that van would allow us to take those physicals and the services the EMC offers on the road?
Yes. Easy answer.
And proven success with it is in the clients that Beth mentioned too.
Okay. I want to go back to our pharmacy dude. Hello. I'd like to, I noticed we skipped over the biosimilar strategy. And that is one thing that I think we've all found in our strategy that we're building is that we really want that opportunity to have those biosimilars in, let me rephrase that. How are biosimilars going to go into the strategy? Will they be part of step therapy? Will employees have to try a biosimilar before the more expensive medications?
Just for the essence of time, I had to skip over that.
I picked him under the table, so we had to skip it.
Slides 17 on the formulary column, we have a biosimilar strategy there as well. So to answer your question, how does it fit into the overall strategy? So we've had a biosimilar strategy for years and we continue to evolve it as other biosimilars come to market. The one big biosimilar that's come to market was the one for Humira. That recently came to market over the past several months. That has been co-preferred as we get into 1125. Yeah, it's been co-preferred. So with co-preferred meaning both Humira and the biosimilar have the same status on the formulary. Once we get into 2025, for any new starts, so anyone new to therapy, they will be instructed or guided to use the biosimilar first. For anyone who's not a new start, they'll be able to stay on Humira until 7/1. So it gives them more time to stay on Humira, work with their doctor, should they need to kind of change titrations, which they shouldn't, by the way, because both Humira and the biosimilar are interchangeable as per the FDA. So those people who are on Humira will have more time to transition over to the biosimilar. That's the one biggie that's out there. There are other biosimilars as well, and I can give you a list of both. But in general, we either prefer or co-prefer the biosimilar alongside the originator brand. The new big one coming to market is for Stellara. That one will be coming to market. We will either co-prefer it alongside Stellara, or we will prefer it. That decision hasn't been made yet, but it will be made within the next few months. But we're gonna either, again, co-prefer or prefer it. We won't have the originator brand at a more preferred status than the biosimilar. We'll either put them alongside each other or have the biosimilar first.
Will the county be part of that decision?
Of how to stage it. Well, we're happy to take input from the county on how to do it. Yeah, so I'll just keep it short. Yes, we'll be able to strategize together on that.
I always am asking the question. So for example, if we have patients who are currently on Humira, you're giving them an opportunity to switch over to the biosimilar. What if there are individuals that does not work for them? Are they allowed to stay on the Humira?
Yes, yes, yeah. That's called a medical necessity step in our process of evaluating. So short answer is yes.
Thank you.
I do have one more question if somebody else doesn't have one. Okay, they didn't speak. All right. On the behavioral health that you were describing, the new program, what were you calling that?
Eval.
That would be part of the capitated fee or be part of the buy-up for the EAP?
So it would be part of the buy-up. And what it is it is an enhanced version of EAP. So it would mirror what you see in the capitated behavioral for the medical plan, but it would be available to all of the employees and all of the members of their households.
Thank you. Welcome.
The Clear Choice RX, is that for all medications or is that just for certain medications?
It's for all medications. So it's a pricing arrangement, meaning that we won't include any spread pricing, meaning like charge you a different price than what we get it from wholesalers. It will be, across the board, across all categories, no spread pricing.
Other committee members with questions?
Okay to make one closing comment if we still have time in Q&A? All right, appreciate it. Thank you again for our time. Thank you again for the business. It is not lost on us that you are all stewards of taxpayer dollars, including my own. So we just wanted to say that we really respect the procurement process. We respect the ability to come together. You all have big weights on your shoulders to make those decisions. And we just want to thank you for the process that you have put through and our ability to participate in your time today. Thank you.
Thank you.
Thank you. Thank you for presenting and being here to answer questions from the committee. Thank you, everybody else, for being here and participating as well. We will go ahead and close out this meeting, and I will shut down the recording, and we will be back for your next meeting at 4 o'clock. Thank you, everyone.
Thank you.
The next meeting is the public meeting. Statute of laws. We've got about 7 minutes. If anybody needs that.
Thank you.